Imagine you are standing in your kitchen. It is a Tuesday evening, nothing special. You reach for a glass on the top shelf, and your hand, just for a second, feels like it belongs to someone else. The fingers tingle, the grip falters. The glass wobbles but does not fall. You shake it off. You blame it on sleeping wrong. Or maybe you leaned on your arm too long. And by the time you sit down for dinner, you have already forgotten it happened. That moment, that brief, strange, forgettable moment, may have been the single most important warning your body will ever give you. Because here is what most people do not know. A stroke does not come out of nowhere. In the vast majority of cases, it sends signals. Quiet, easy to dismiss signals. Sometimes 24 hours before it hits, sometimes 72. And most people miss every single one of them. Not because they are unintelligent, because they were never taught what to look for. In 15 years of clinical practice, I have watched patients sit across from me in hospital beds. Intelligent, capable people, and say the same sentence over and over again. I felt something the day before, but I thought it was nothing. That sentence has haunted me more times than I can count. The healthcare system does not profit from you knowing what a stroke looks like before it happens. There is no billing code for a 20-minute conversation about pre-stroke warning signs. That is exactly why this channel exists. Subscriber moves us closer to building something the system will not give you real answers in plain language before it is too late. Now let me reframe this for you, because most people are carrying a fundamentally wrong picture of what a stroke is. You have probably been told that strokes are about high blood pressure and high cholesterol, that they are a disease of the elderly, that they are random, a bolt of lightning that either hits you or it does not. None of that is accurate. A stroke is not a random event. It is the final step in a process that has been building, sometimes for years, sometimes for days, and almost always with warning signs that get explained away as stress, fatigue, or age. The real problem is not that your body fails to warn you. It is that no one ever taught you the language your body uses to send those warnings. And here is what nobody tells you. Nearly 30% of strokes are preceded by something called a transient ischemic attack, or TIA. Within the days or weeks before the main event, a TIA is essentially a min-stroke. It produces real, measurable neurological symptoms, but they resolve on their own, often within minutes. So the person shrugs it off. They never call anyone. And then the full stroke arrives. But before I give you the warning signs, you need to understand what is actually happening inside your brain when a stroke occurs. Because the signs will make far more sense once you see the machinery behind them. Your brain is the most energy-hungry organ in your body. It weighs roughly 3 pounds, but it consumes about 20% of all the oxygen your blood carries. It does this through an extraordinarily dense network of blood vessels, arteries, arterioles, capillaries that snake through every fold and region of the brain. Think of it like a city with millions of roads, and every road is delivering fuel to a different neighborhood. Now, a stroke happens when one of those roads gets blocked or burst. When a blood vessel is blocked by a clot, by a chunk of plaque that breaks loose from an artery wall, by a narrowing that has been building for years, the neighborhood it feeds starts to die. That is an ischemic stroke, and it accounts for roughly 87% of all strokes. The brain tissue downstream from that blockage is suddenly starved of oxygen and glucose. Within minutes, cells begin to die. The other type, a hemorrhagic stroke, happens when a vessel actually ruptures and bleeds into the surrounding brain tissue. The blood itself is toxic to the delicate neurons around it, and the pressure from the bleeding crushes adjacent tissue. Either way, the result is the same. A region of the brain loses function, and whatever that region controlled, speech, movement, balance, vision, comprehension, begins to fail. Here is the critical piece. Before that full blockage happens, there are often partial blockages, brief interruptions, tiny clots that form and dissolve. And those partial events produce partial symptoms. They come and go. They last seconds, minutes, maybe an hour, and then they vanish. That is your warning. That is the day before. Here are the warning signs most people completely miss. Warning sign number 1, a sudden brief episode of numbness or weakness on one side of your body. This is the most common pre-stroke signal, and it is the one most often dismissed. It may feel like your hand went to sleep, or your leg suddenly felt heavy, or one side of your face felt slack or droopy for just a moment. The key word is one side. A stroke affects one hemisphere of the brain, which controls the opposite side of the body. So if you feel sudden numbness or weakness that is isolated to one side, even if it goes away completely within 5 minutes, that is not a pinched nerve. That is not sleeping on your arm wrong. That is a potential TIA, and it means a clot or blockage briefly interrupted blood flow to the motor or sensory regions of your brain. Clinical research suggests that roughly 43% of people who experience a full stroke reported one-sided weakness or numbness in the days before the event. Write this down. One side, brief, unexplained. That is the pattern. Warning sign number 2, a sudden difficulty with speech or understanding speech. You are in the middle of a sentence and the words disappear. You know what you want to say, but the syllables come out jumbled or simply will not form. Or the opposite. Someone is talking to you and their words sound like a foreign language. This is called aphasia. That simply means a disruption of the brain's language processing. The language centers of the brain, primarily located in the left hemisphere, are exquisitely sensitive to even brief drops in blood flow. A partial blockage lasting 30 seconds can scramble your ability to speak or comprehend. And because it resolves quickly, people chalk it up to a senior moment or being overt tired. It is not a senior moment. It is a neurological event with a specific vascular cause. Warning sign number 3, a sudden and severe headache with no obvious explanation. I am not talking about a tension headache or the dull ache you get after staring at a screen all day. I'm talking about a headache that arrives like a thunderclap. Sudden, intense, unlike anything you have felt before. This type of headache can signal a hemorrhagic event, where a small bleed is occurring in or around the brain. It can also occur with ischemic events, particularly in the posterior circulation, the blood supply to the back of your brain, which handles vision, balance, and coordination. If you experience a sudden, severe headache, especially if it is accompanied by nausea, neck stiffness, or sensitivity to light, you need to take it seriously. This is not a migraine. This is the part that may genuinely surprise you. Many people who later had a major hemorrhagic stroke reported an unusually intense headache 1 to 3 days before the event. Warning sign number 4, sudden trouble with vision in one or both eyes. This may manifest as blurriness, double vision, or a partial loss of your visual field, meaning part of what you normally see simply goes dark or becomes obscured. The visual cortex sits at the very back of your brain, and it is fed by the posterior cerebral arteries. A brief clot in this area can cause what is called amaurosis fugax. That simply means a temporary loss of vision, often described as a curtain or shade being pulled down over one eye. This can last seconds to minutes and then resolve completely. Most people assume it as an eye problem. They schedule an appointment with their optometrist for the following month. Listen carefully because this is critical. Temporary vision loss is a brain event, not an eye event. It means blood flow to your visual cortex was interrupted, and the cause is upstream in the vessels feeding your brain. Warning sign number 5, a sudden loss of balance or coordination. You are walking down a hallway and suddenly veer to one side. You reach for a door handle and miss it by 3 inches. You stand up from a chair and the room seems to tilt. The cerebellum, which sits at the lower back of your brain, is your coordination center. It also relies on a dedicated blood supply, and when that supply is briefly compromised, you experience what clinicians call ataxia. That simply means uncoordinated movement. This sign is particularly common in posterior circulation strokes, which are among the most frequently missed because the symptoms dizziness, imbalance, clumsiness mimic so many other conditions. But here's the distinction. If the dizziness comes on suddenly, lasts briefly, and resolves on its own, especially if it is paired with any of the other signs I have described, it is not vertigo from an inner ear issue. It is a warning. Warning sign number 6, sudden confusion or difficulty with simple cognitive tasks. You are trying to use your phone and cannot remember how to dial a number. You look at a clock and cannot tell what time it is. Someone asks you a simple question and your mind goes completely blank. This is not normal absent-mindedness. This represents a temporary disruption to higher cognitive function, usually in the frontal or parietal lobes. When blood flow dips in these areas, even for 60 to 90 seconds, your ability to process, organize, and respond to basic information can shut down briefly. And because it resolves, you convince yourself you were just distracted. You were not distracted. Your brain was briefly suffocating. Warning sign number 7. 7, an unusual and overwhelming fatigue that comes on without explanation. This one may be the most overlooked of all. Clinical data suggests that sudden unexplained exhaustion, when particularly in women, can be a pre-stroke symptom. This is not the tiredness you feel after a long day. This is a bone-deep fatigue that makes you feel as though you physically cannot move or stay awake. Researchers believe it may be linked to the body's inflammatory response as small clots form and dissolve, or as the brain's oxygen demands exceed what compromised blood flow can deliver. If you have felt fine all week and then suddenly feel as though you have been awake for 3 days straight, do not assume it is just your age. Most people miss this entirely. Let me tell you about a patient named Margaret. She was 61, a retired school teacher, sharp as anyone I have ever met. She came into my office for a routine visit and mentioned, almost as an afterthought, that she had a strange episode the previous week. She was grading old papers she kept for nostalgia, and suddenly the words on the page looked like nonsense. She could see the letters, but they would not form words. It lasted about 2 minutes and then cleared up. She laughed about it, said she needed new glasses. 2 days later, she had trouble zipping her coat. Her left hand was clumsy and weak for about 30 seconds. She blamed arthritis. When she told me this, I stopped asking about her glasses. I stopped asking about her joints. I started asking about her blood vessels. We ran a carotid ultrasound and found a 60% narrowing in her right internal carotid artery, a buildup of plaque that had been silently growing for years. That plaque was throwing off tiny fragments, microemboli, that were briefly blocking blood flow in her brain and then dissolving. Each episode was a TIA. Each one was a warning shot. We got Margaret on the right protocol immediately. Blood flow support, vascular monitoring, lifestyle changes. I will share with you in a moment. Within 3 months, her follow-up imaging showed stabilization. She never had a stroke. But I will tell you this, if Margaret had ignored those signs for another 2 weeks, the story might have ended very differently. She later told me that the only reason she mentioned those episodes was because she had watched a video like this one. That is why I do what I do. Now let me take you deeper into the mechanism because I want to bust a myth that may be putting you at risk. Most people believe that stroke prevention is about lowering cholesterol, that if you get your LDL number down, you are safe. Let me be direct with you. That is not the complete picture, and in some cases, it is dangerously misleading. The real driver of stroke risk in most people is not the amount of cholesterol in your blood. It is the health of your endothelium. That simply means the thin inner lining of your blood vessels. When that lining is damaged by chronic inflammation, by high blood sugar, by oxidative stress, by years of high blood pressure pounding against arterial walls, it becomes sticky. It attracts plaque. It promotes clot formation. You can have perfectly normal cholesterol levels and still have a severely damaged endothelium. That is not an exaggeration, that is data. Published research has consistently shown that a significant percentage of stroke patients had cholesterol levels within the so-called normal range. What they had was endothelial dysfunction, inflamed, damaged vessel walls that were actively promoting clot formation. So if you have been told your cholesterol is fine, you are not at risk. Ask your doctor about your C-reactive protein levels, your fasting insulin, your hemoglobin A1C. Those markers tell you about inflammation and metabolic health, the actual terrain where strokes are born. Now here is something worth noting. The risk profile for stroke changes significantly with age. After 40, the endothelium begins to lose its ability to produce nitric oxide efficiently. That is the molecule that keeps your blood vessels relaxed and flexible. After 50, arterial stiffness accelerates measurably, and the risk of atrial fibrillation, an irregular heartbeat that promotes clot formation, begins to climb sharply. After 60, the cumulative burden of inflammation, plaque buildup, and reduced vascular elasticity means that the margin between a warning sign and a full event narrows considerably. How old are you? Write it in the comments. I want to see which age group makes up most of our viewers, because the urgency of starting this protocol is genuinely different at 45 versus 65. And I want to make videos that meet you where you actually are. Here's the practical protocol. These are steps you can begin today with no special equipment, and each one is mechanistically justified. Step 1. Walk briskly for 30 minutes every single day, first thing in the morning. Walking stimulates the production of nitric oxide in your endothelium, which dilates blood vessels, improves blood flow, and reduces the stickiness of your arterial walls. Morning is the ideal time because your blood is thickest and most clot-prone in the first 2 hours after waking. 30 minutes every day, non-negotiable. Step 2. Hydrate immediately upon waking with 16 ounces of plain water before anything else, before coffee, before food. Dehydration thickens your blood and increases clotting risk. Your body has been without fluid for 6 to 8 hours during sleep. That first glass of water is not a wellness trend. It is a direct intervention against the conditions that promote clot formation. Step 3. Perform a simple daily blood pressure check at home at the same time each morning before eating or drinking coffee. Record the numbers. You are looking for consistency. A systolic number, the top number that swings more than 15 points from day to day, or that routinely sits above 130, is telling you something about your vascular health that a single reading in a doctor's office once a year will miss. Home blood pressure monitors are inexpensive and available at any pharmacy. 5 minutes a day, do it. Step 4. Reduce your intake of refined sugar and processed carbohydrates meaningfully. I'm not talking about a diet. I am talking about understanding that chronically elevated blood sugar damages your endothelium directly. It glycates the proteins in your vessel walls. That simply means sugar molecules bond to the structural proteins and make them stiff and dysfunctional. Cut back on white bread, sugary drinks, packaged snacks. Replace them with whole vegetables, lean protein, nuts, and legumes. This is the single most impactful dietary change you can make for your vascular health. It costs nothing. Start this week. Step 5. Practice slow, deep breathing for 5 minutes before bed, 3 to 5 times per week. Inhale through your nose for 4 seconds. Hold for 4 seconds. Exhale through your mouth for 6 seconds. This activates your parasympathetic nervous system, lowers cortisol, and reduces chronic inflammation, all of which directly protect your blood vessel lining. 5 minutes before sleep. It works because it lowers the systemic inflammatory load that degrades your endothelium night after night. Step 6. Ask your doctor to check your choroid arteries with an ultrasound if you are over 50 and have never had one. This painless, non-invasive test can reveal narrowing in the arteries that feed your brain, often years before it causes a stroke. It takes 15 minutes. It could save your life. If your doctor dismisses the request, find one who will not. Step 7. Eliminate or drastically reduce alcohol consumption. Even moderate alcohol intake raises blood pressure, promotes atrial fibrillation, and impairs the liver's ability to regulate clotting factors. Clinical data is increasingly clear on this. If you are drinking more than 1 serving per day, you are adding measurable stroke risk. This is not a moral judgment, it is physiology. Before we go further, I need to say this clearly. There are symptoms that should send you to a doctor or an emergency room immediately. Not tomorrow, not next week, today. If you experience sudden weakness or numbness on one side of your body that lasts more than a few minutes, call emergency services. If you suddenly lose the ability to speak clearly or understand someone speaking to you, call emergency services. If you develop a sudden, severe headache unlike any you have had before, especially with neck stiffness or vomiting, call emergency services. If you experience sudden vision loss in one or both eyes, even if it seems to improve, go to the emergency room. These are not things to monitor at home. These are not things to sleep on. Every minute of delay in treating a stroke costs approximately 1.9 million neurons. That is not a metaphor. That is published clinical data. Time is brain tissue. Act immediately. I am Dr. Henry Collins. I have spent 15 years watching patients waste time and money on treatments that target the appearance of a problem, while the actual cause, damaged blood vessel walls, chronic inflammation, metabolic dysfunction, keeps quietly getting worse beneath the surface. No one sitting in a white coat in a clinic office is going to walk you through what I just walked you through. There is no billing code for a 20-minute explanation of how your endothelium works and why it matters more than your cholesterol number. The system generates revenue from visits, procedures, and prescriptions, not from patients who understand their own vascular health well enough to protect themselves at home with correct information. This is not your fault. You were never told the real cause. But now you know, that changes everything. Subscribe to Dr. Henry Collins and hit like. Every subscriber helps the next person who needs this find it. And if this helped you, send it to someone you love. You may have just given them a real chance to catch something early. Perhaps the day before it would have been too.